Hello and welcome to another edition of your favorite health program on TV, Health Affair. On the program, we'll focus on health issues and challenges of women and children with a view to finding lasting solutions. I am your regular anchor, Oshuomowa Daniels. On the program today, we shall be discussing about stem cell therapy, also known as regenerative medicine. Before we delve into this interesting topic of stem cells, let's take you through our news segment.
Federal government is set to roll out mass vaccination plan for Nigerians to achieve its target of vaccinating 50% of the population by 2022. The chairman, Presidential Steering Committee on COVID-19, Boss Mustafa, made the disclosure on Monday at the national briefing on COVID-19, assuring that efforts are on to bring on board booster shot vaccines. No fewer than 135 private health facilities have been enrolled into the Lagos State Government mass vaccination strategy targeted at vaccinating 4 million residents by December 2021, bringing the total number of public and private vaccination sites in Lagos to 360. The Commissioner for Health, Akin Abayomi, said the enrolled private facilities were engaged after a rigorous selection and accreditation process that hinges on quality assurance, vaccine safety, and follow-up care. He added that the state government decided to partner with the private sector to rapidly increase COVID-19 vaccination in order to achieve herd immunity.
For Rashid Benro, who had a sister with sickle cell anemia, Azizat Olajumoke Benro, the various stages of trauma and pains, including other challenges associated with the disease, is better imagined than experienced. His sister was fortunate to attain the age of 50 because she had access to quality health care. This is, however, not the story for some Nigerians, as many have died after being diagnosed of the disease due to complications in their early age.
Basically, she was always, an advocate for helping, and this foundation is to continue to further that initiative that she started while she was here with us, and in remembrance of how we have pledged to continue what she started. Our first project was to provide a monitoring system at the maternity unit for Luth. That was executed earlier in the year. This is our second project, with conjunction with Dr. Akinomi here to provide these equipment for the pediatric unit here at Lasuth. And we hope to be able to further this initiative. This is not the end. This is only the beginning of what we have planned, as far as this project is concerned for the healthcare facilities and industry in Nigeria.
Before we talk about the equipment, let me just seize the opportunity to thank the Gbenro Foundation for even deeming it fit to do this. A lot of wealthy individuals in Nigeria should be encouraged to do a little bit more for the citizens in terms of health care. Now, these equipment that have been donated are awesome. The first one is the equipment that would detect in a newborn baby the possibility that he has sickle cell anemia. In the past, it takes about 6 to 9 months before we are able to know using the conventional equipment. But with this equipment, as soon as a baby is born, and they're tested, we'll be able to know whether they are carrying the S gene or not. The other equipment is a Doppler machine, which is to assess the risk of stroke in sickle cell children. And it's very important to know whether they are at risk of stroke, because if that information is not known and they do have a stroke, it may be too late to assist them. So with these two equipment, there are better days here in Ikeja, Lasuth, for children who are suffering from the sickle cell disorder. So what I want Nigerians, especially the very wealthy and the high net worth individuals, what I want them to learn from this gesture is that with as little as 20 million naira, you can totally change the lives of millions of people as far as their health status is concerned. And I'm appealing to high net worth individuals to come to LASUTH Ikeja to see what they can do. There are still many areas of need that we have. The government is doing its best. It can't do it all.
Sickle cell anemia is a disorder that causes the red blood cells to become sickle-shaped, with its consequential threats to life.
An inherited disorder. Both parents have to give an abnormal gene, an S gene, to a child. The child has to inherit that from both parents before they can have sickle cell anemia. They are born with it, and very few people are able to access the cure that will prevent them from having sickle cell symptoms and complications. And sickle cell is feared quite a bit because of the chance of premature death.
The surer way about sickle cell disease will be the bone marrow transplant, which is a technology that's available in Benin for now, but we are looking forward to establishing a transplant program here in Ikeja as well.
About 100,000 cases are recorded annually in Nigeria, according to reports.
The National Agency for Foods, Drug Administration and Control, NAFDAC, has confiscated multiple cartons of banned drugs, including 2,200 cartons of codeine syrup, 10 cartons of tramadol, valued at over 3 billion naira in Lagos. Speaking with newsmen in Lagos, the Director General of the agency, Christiana Adeyeye, said the falsified medicines in 2 warehouses owned by one Chuka, Akumia, were discovered at the Trade Fair complex during a raid by the Investigation and Enforcement team.
Pertinent to mention that any strength above 100 milligram not registered is banned due to deleterious effects on vital organs of the body, such as the central nervous system and the brain. Furthermore, 1,200 cartons of banned analgesic injection, 500 cartons of asthma artemether injection, 534 cartons plus 300 packets of biomal anti-malaria artesunate injection, 188 cartons of Hydra and Black Cobra, 98 cartons of super artesunate injection, among others, worth over 3 billion naira. Over 20 truckloads of the offensive products were evacuated from the 2 locations. The products were stored at temperatures above 40 degrees centigrade, which ordinarily would denature or break down some of the active ingredients and the excipients that are used to make the products.
Following the disclosure by a suspect that the Cocoa Pops, cornflakes, oats, and other cereal products for sale in transparent nylon were sourced from Loma waste disposal trucks before repackaging into transparent nylons, the Director General warned the public not to purchase cereal that have been removed from their primary packaging so as not to jeopardize their health, especially that of their children.
Pained because infants and children are the target and the ultimate victims of such wicked and evil activities. The agency has also commenced the raids of markets and supermarkets with the aim of mopping up unregistered NAFDAC products during this festive period. Customers are hereby enjoined to shine their eyes when making purchases of products and should not patronize roadside and street vendors.
The Director General called for greater collaboration with religious leaders, traditional rulers, and the general public to assist with relevant information to track the merchants of death. 12 dock workers are currently cooling their heels with the National Drug Law Enforcement Agency, NDLEA, over their involvement in the 9.5 billion naira cocaine seized at the Lagos port. NDLEA spokesperson Femi Babafemi said investigations showed that the dock workers have significant links to the importation of the seized illicit cocaine weighing 32.9 kilograms. The anti-narcotic agency had on October 13th intercepted a ship at the Apapa seaport following intelligence from international partners and support from other security forces such as the Nigerian Navy, Customs, DSS, and the police. A thorough search of the ship led to the recovery of 30 parcels containing cocaine. A federal high court in Lagos later granted an application by the agency for the interim attachment of the vessel.
A road work by officials of the Federal Road Safety Corps, LASTMAN, and some health experts around the Lagos state capital, Ikeja, to raise awareness about road traffic accidents is a fact on Nigerians, especially the productive age group, and the need for people to maintain safe speed.
The trauma, the pain, the anguish victims of road traffic accident go through. Some are permanently disabled, some may not be able to move on with life again, and most importantly, the deaths. So it should be a thing that they all should be concerned.
First, we need to remember those who we have lost in road traffic crashes, then support especially the rescue teams and the first responders who actually are always at hand to always render rescue to victims of road traffic crashes. And also, it is time for every one of us to start acting. And in acting, we need to start with sensitizing people.
With the theme, Remember, Support and Act Now, health experts also called for post-crash care support and effective emergency response system.
Or you're putting your TSR in entertainment. Remember road traffic victims. Remember that post-crash care and pre-hospital care for Nigerians can go a long way in saving a lot of lives.
For this particular project, we partner with corporate bodies in the business world who have been supporting this project, such as UPS and other important MRS that have supported this in the past. And then we'll partner with individuals who are willing to support the project by donating to this our cause, which actually aimed at supporting the indigent patient and a road accident. Particularly today is on road accident, just to ensure that anybody who has misfortune or being involved in road accident is kept alive until the family or friends or relations come upon to support the victim. The first we did was to ensure that the person is kept alive. That's why we always call it none should die. This I've been running with the Road Safety Commission for the past 6 years.
The theme for this year says act low speed in streets too. And the slogan is that we should remember, we should support and act. Hey, don't be part of those we'll be remembering. Don't be part of the statistics. And in not being part of it, you have lots of things to do. Maintain safe speed, avoid drunk driving, don't use your phone while you drive. I'm very sure if you stick to this, every one of us will enjoy quality road experience, especially this Ember months.
A recent report by the World Health Organization, WHO, estimated that about 1.3 million people die annually from road traffic accidents, with Nigeria contributing a larger percentage to these figures.
Effort by the federal government on COVID-19 mass vaccination for Nigerians is gaining more support from critical stakeholders in the nation's health sector. Speaking at a forum under the theme, Role of Family Physician in the Era of COVID-19 Infection and the Role of Vaccines in Preventing Communicable Diseases, the President of Society of Family Physicians of Nigeria, Dr. Nnadozie Paul Obiegbu, said effective pandemic response demands surveillance and appropriate use of vaccines as a preventive strategy.
COVID-19 is by no means the first pandemic the world has seen, and is more than likely not the last. An effective pandemic response demands surveillance, containment, border control, and various community measures, which involve the contribution of family physicians and primary care practitioners. Furthermore, the management of COVID-19 requires constant triage, prompt diagnosis, and early appropriate treatment.
Nadozie and other family physicians also spoke on the relevance of modern technology in the control of the COVID-19 pandemic and general health care delivery.
But some of the things that we have done is to use things that are known by everyone, like WhatsApp, for example. To be able to use WhatsApp to create support groups for a particular medical problem. Of course, this is after their consent. To also increase the participation of the patient themselves in understanding their medical problem and approaching the health facility at the right time.
How comfortable are they wearing masks? What proportion of our patients know how to wear it correctly and use it correctly? How comfortable are people with hand washing? Do they understand the steps? So they are very basic things that we as primary care clinicians, we interact with our patients, and part of our research to inform the wider community and to help improve things.
Everybody maintains the protocols of prevention. The numbers are less. The third wave, would I say, has come down, but it's still there. The next person you'll see may be COVID positive, even among us here, right? And you can feel the saliva as I speak, so be careful. Simple, wash your hand, use your sanitizer, keep a distance, and how we know it to be. Let's keep going on until the last phase expressing that all for like, unless for 7 months and no policy case. Until then, the risk becomes high for us. For everybody, and also for the doctor, and also for the family physician, who will receive them raw as they come, as first.
Family physicians, being the first point of contact for many diseases, also serve as warning agents for detecting emergence of novel strains.
Our way of life. Service. Our way of life. Service. In Lionism. We serve. Together. We serve better.
In service to humanity, the Lions Club International, District 404B2 Nigeria, has carried out surgical intervention for some residents in the southwest zone of Nigeria who cannot afford cataract surgery.
So we are doing it for them free of charge. From Lagos axis, we have 50 people who are doing cataract surgery for free of charge. In the other axis, we have the Ekiti axis, we have the Osun axis, we have the Kwara axis. All these other axes we also have people that also benefit from this procedure. And in a nutshell, about 100 people are supposed to benefit from this free cataract surgery under the Lions Club District 404B2. And it commenced on the 13th of October with a walk. We had a walk from Lasut, and we ended up at Onigbombo LCDA at Ikeja. The next day, we had a screening exercise where we were able to screen the people that we gave out free glasses to 1,000 people, and then we were able to screen 50 people from our zone, Lagos zone, that have started doing the cataract surgery.
Speaking with the press during the procedure at the General Hospital Ota in Ogun State, some of the experts noted that cataract is the leading cause of blindness in the world.
Cataract, unlike glaucoma that basically has no definite cure, for cataracts now, once they are operated upon, without any complications, they see very well again. So a couple of them, like the ones that were here last week, many of them have been appreciative of what we have done for them in Lions Club, and we hope that the 10 that are going to benefit today would have no complications at the end of the day.
I'm very happy that Lions raised this fund for me, for doing the test for me free, because since almost a year I've not seen very well, particularly these eyes, I can't see with it. And since I heard that Lions are doing it for them, and I come and face the interview, I did the test, the necessary test, and they have done the surgery for me last week, and I can see very well now. I'm very grateful about what they have done for me.
Thank Almighty God for giving me that opportunity. And also I thank Lion Club for giving us the big opportunity to do the surgery for us without taking any kobo from us. So God continue to bless them in many, 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 many ways.
The event provided an opportunity to create awareness on the need for regular eye check to prevent blindness.
Time, it's usually a preventable issue, but because we don't take time to do screening or to take a proper awareness of our eyes, so many things could go wrong. But what we are after as a Night of the Blind is to ensure that we put the information at the doorstep of the people, that they should be very, very careful with their eyes and they should go for periodic checkup. You understand? If they go for a periodic checkup, there are things that could be addressed without getting to surgery level. But at this level of surgery, it means damage has been done. We are only doing rectification. But rather, we prefer to go through the preventable ones to put the information out there for them to ensure that they take proper care, take every necessary precaution to ensure that they did not damage their eyes.
The Lagos state government has warned of a possible fourth wave of the COVID-19 infection, identifying the volume of inbound passengers coming into the country for Christmas. With this in mind, speakers here say the mass vaccination initiative could not have come at a better time.
It was a big challenge to social workers because the pandemic was least expected. But we represent the voice of the voiceless and the voice of the vulnerables. Within our limited resources, we participated actively in bringing hope to the infected and the affected. And this is exactly what we did. And we are very much happy that we recorded a max at least above or close to maximum result. It is very, very important and very necessary for Nigeria to be vaccinated to reduce the level of this spread of this pandemic.
The worsening unemployment rate, poverty and insecurity crisis that has made more Nigerians vulnerable and in need of social welfare was also an issue of concern.
This critical issues of security, respected and institutionalized roles. We represent the voice of the voiceless and the voice of the vulnerable. This is one of the darkest periods in the history of Nigeria. It's a critical moment. We have some systemic issues to be addressed. The banditry, terrorism, kidnapping, raping, and unemployment rate, and again, poverty. We have to bring our economic experts together to find and intelligence experts to address these critical issues of security, and economic experts to address the critical issue of poverty. Because the phenomenon is open for even a blind person to see. We pray that Nigeria doesn't become a failed state, but adequate steps must be taken in order not to make this happen. We don't want a repeat of Somalia, Libya in Nigeria.
If you build a well-paneled houses and keep ourselves indoor, and we don't care about our neighbor, we'll be surprised that those neighbors we don't care about go out and come back to forcefully open the door. So the Nigerians need to a new orientation and awareness towards becoming a brother's keeper, towards covering for other people. Like I said, the quality of your life depends on the quality of people or the condition of people around you.
The Ubuntu is a message of social inclusion, social solidarity, whereby the less privileged, the rich, the men, the women, they will have sense of belonging. And this is a message for each and every one of us that no matter how we are, no matter where we are, we should preach the message of love, message of solidarity, message of social inclusion, whereby there is people will call the vulnerable groups, the person with disabilities, the aged, the women, the pregnant women. They are vulnerable people because they do not have, a kind of power to which other group of people have. So that is why the IFSW they choose that particular team.
For the humanitarian service workers who strive for a just and peaceful society to function better, they also called for a quick passage of the Nigerian Council for Social Work Bill pending at the National Assembly.
The issues we are facing are enormous. Basically, it has to do with legislation of our profession. You know, there is no bill backing our profession, unlike other professions. And you know, we do a lot in terms of justice, human rights, domestic abuse, and what have you. So we need, for actions that we take, we need to have legal backing. So it doesn't put us at par with other social workers all over the globe. So we are really seeking and advocating that the government of Nigeria would support and ensure that the bill, the 2012 Council of Social Work Establishment Bill, is passed into law.
The need to stop discrimination against persons with disability and for more people to assist persons with amputated limbs was reiterated on Friday, 19th of November 2021 during the NNPC Sickle Back to School project handover event. The goal of the Back to School is to reduce the number of out-of-school children with disabilities through the provision of prosthetic limbs for indigent child amputees.
Welcome back. Stem cell therapy, also known as regenerative medicine, promotes the repair response of diseased, dysfunctional, or injured tissues using stem cells or their derivatives. This promising field of regenerative medicine is also working to create solutions for organs that have become permanently damaged. With the increased disease burden and mortality rate in Nigeria, a young regenerative medicine and molecular genetics expert, Ogunleye Toluwalope, says stem cell therapy is the way to go.
Regenerative medicine is a branch of medical science that deals with regenerating. Now, just from the word regeneration. Now, it means repair, renew, and rejuvenating the cells and the body. We realize that some of the diseases are born out of damages done to the cells. We could remember then in our classes in biology, they taught us that the basic unit of life is cell. So, you know, the body is classified in this category. We have the cells, we have the tissue, we have the organ, and the system. Now, the group of cells make the tissue, the collection of tissues make a particular organ, and the group of organ make the system. So most of the diseases are done or are from the cellular point of view, or another point to say the molecular point of view. Maybe a particular issue with the DNA, an error in the genes and all the likes. Why some diseases are based to the cell, perhaps the brain cells, the muscle, the cells in the muscle, or I'm sorry, the cells in the heart or the muscles in the heart. So some of these diseases are to that extent. And you know, when it comes to medication, medications only take away the pain or the symptoms or some of the things that comes out of the disease. But the main aim or the main core aim of or the causes of this particular disease is not being treated. And that is why regenerative medicine is coming into play. Now, regenerative medicine is mainly focusing to deal with the main cause of disease from the cellular point of view, repairing the cells. It has the ability to also build up another cell. Now, there's a way our body system is being formed. We have the ability to repair or to also heal some disease. Now, when you see some people when they have wound, after a particular point of time, even without taking any medication or anything, the wound heal by itself. That is how people are being structured. Now, but if we are unable to engineer our body or the cell to the point at which this thing or this repairs will come by itself, and that's why a field of regenerative medicine is coming into place to enhance the ability for human to repair damages to the cells, to the tissue, and to the muscle of some particular organs or system.
What informed the idea of regenerative medicine? Is it that the normal clinical medicine is no longer effective? What does regenerative medicine do? What are the advantages? What makes it different from the clinical medicine that we're used to?
Big advantage. Now, there is a lot of advancement in science. Science is developing a lot of things every now and then, and the one of the main benefits of regenerative medicine is dealing with some of those diseases that normal medical science has said that there is no cure. Or perhaps let me say some of these diseases that the only thing they can do to them is to manage. Diseases like stroke, diseases like autism, diseases like diabetes, diseases like hypertension, diseases like lupus, diseases like multiple sclerosis, diseases like cerebral palsy. At the moment, medical science will tell you that all these diseases are just manageable, or you just begin to take care of the symptoms that they present. But with the help of regenerative medicine, we are able to target the main cause of the disease way back to from the cellular point of view. And we are able to repair the cells. Now, when you repair the cells, like the muscle cell, when it comes to neurological cases like stroke, like cerebral palsy, or let me say like autism, we're able to take it back. Now it is from central nervous system. Now we're able to shoot a particular element in regenerative medicine, which is adult stem cell therapy. We're able to make use of stem cell. And now stem cells are cells that are natural cells. They are found in the body. And these cells has the ability to repair, to renew, and to rejuvenate. And these cells too, they take the form or the shape of any particular place that they are being put. It's just like a mother hen giving birth to different, laying different eggs. One can either be a chick, a male hen, or one can be a female. That is how stem cells are. So we are able to get stem cells from different sites. From the adipose, which is fat. We're able to get stem cell from the placenta, which is, at the moment, science is saying is the richest site of stem cell. We're able to get stem cell from fat, from the placenta, from the umbilical cord tissue, from bone marrow. We used to hear of bone marrow transplant. Now, the same stem cell gotten from all these places are the same, but different name. Now, the one in bone marrow, we call it hematopoietic stem cell, which has to do with blood-related stem cell. But the one in fat, the one in umbilical cord tissue, the one also in placenta, we call that one mesenchymal stem cells. Now, those ones are the ones that take care of diseases that will be neurological diseases. Now, though, under regenerative medicine, we have different classes of regenerative medicine. Now, the one I'm talking about now is what we call cell therapy. Under regenerative medicine, we have organ transplant. When you hear of organ kidney transplant, is under regenerative medicine. When you hear of cloning, it's under regenerative medicine. When you hear of stem cell therapy, it's under regenerative medicine. So the one that we are really allowed to, because of bioethics and some other stuff, the one we are really allowed to delve into, and we are able to make use of it for the advantage of people, is the stem cell therapy, whereby we make use of the stem cell for the treatment of, at the moment, for over 30 diseases that normal medical science will tell you that they are untreatable. I've made mention of stroke, I've made mention of cerebral palsy, spinal cord injury, autism, sickle cell anemia, and all the likes, lupus, because the stem cell has ability to, it has an anti-inflammatory ability and also an anti-immunomodulatory ability. So when it gets to a particular part of the body, it has the ability to what? To reduce inflammation. It has the ability to repair. Now, when it gets to a particular part or the cell, it goes there and repairs everything that is there. Now, let's make use of autism, for example. The effect of autism is caused by an error from the central nervous system. And you see, that's why it's called autism broad spectrum. A lot of child come up with different things. Now, when we are making use of stem cell therapy to cure this disease, or basically we say when we are using the stem cell to be able to assist the children with autism, the stem cell therapy is being injected either through intravenous or through intrathecal. And when it gets into the body through the intravenous method or through the intrathecal, it has the ability to go to the central nervous system now to reduce inflammation first. It has the ability to reduce and to repair any damage in the cell. Now, stem cell therapy has been in place since early 90s, basically 1990s. And due to the source of this stem cell, regenerative medicine, but stem cell therapy, we're able to have some, some issues with some bioethics and some political stuff, looking at the fact that the stem cell is being gotten from placenta and all the like. So, because of religious ethics and some political ethics, and at some points they were trying to do a research whereby they have to destroy the embryo, So people were questioning the use of regenerative medicine based on the fact that it's source of the stem cell. But gradually, with the advancement in science, we're able to realize that there are other sources, and you don't need to destroy a baby before you get the stem cell. You cannot definitely, after the baby is being given birth to, you collect the cord, the placenta that people throw away. You collect the placenta and the cord, you process it, even from fat or from bone marrow. So with the fact that they realized that they could get stem cell from different sites or different sources, now it was they're able to expand it. At the moment in Nigeria, we're able to use the stem cell to treat diseases like sickle cell. Now we now have the ability to use the cord blood, the blood in the cord or the placenta, or another source of hematopoietic stem cell, which we call the peripheral blood. We are able to use that to change a genotype from SS to AA or to AS. We are also able to make use of this stem cell to manage conditions like stroke. We're able to manage conditions like osteoarthritis, rheumatoid arthritis. We're able to manage conditions like spinal cord injury, hip injury. We're able to manage conditions like autism. We're able to manage conditions like lupus. We're able to manage conditions like cerebral palsy. We're able to manage conditions. At the moment, in some other countries, they are already making use of stem cell to cure to manage type 1 diabetes and type 2 diabetes. And we all know how diabetes has gone deep into medical science, whereby most people, when they have diabetes, the only thing they can do is that they are on drugs forever and some dietary plans. And whereas that's all. They are being careful, but now with the advancement in science, looking at the fact that stem cell therapy can be able to now regenerate the error in when it comes to diabetes the diabetes is caused when the kidney does not when it does not process well again. The kidney does not have the ability to process well again now, and there's no production of insulin for breaking down of sugar and all the likes. At that point in time, people come down with those things when the kidney and some other dietary system or organs in the body does not break down sugar well. At that point, people come down with different types of diabetes, either type 1, type 2, and other likes. Now, but with the help of stem cell therapy, in some countries, they've been able to get the stem cell inserted into that region, and they're able to regenerate. There was a study in America whereby they were able to make use of stem cell for cardiovascular issue. During COVID, a research came on where they said that they were making research on the use of umbilical cord tissue for patients that are down with COVID. Then they start having issues with lungs, the pulmonary issues and all the likes. They were able to make use of stem cell therapy to reduce inflammation, because at that time, one of the things that COVID comes down with is inflammation. So they were able to use the stem cell therapy to reduce inflammation. So a lot of science, a lot of advancements, a lot of things are going on in the field of regenerative medicine. The only concern at the moment is the fact that regenerative medicine, just from the word regeneration, it's a process. It's not something that comes instantly. Now, a child that has come down with autism for a particular period of time, it might take time for the brain cells that was damaged, it might take time for them to be able to regenerate. It might not be instant, probably after the therapy. It might not be immediate. The child might need to also undergo some other therapy, maybe like speech therapy, some other therapy, physical therapy, occupational therapies, and other likes. But what stem cell has done is the fact that stem cell has created a platform whereby all the cells that are responsible for what the child was doing, all the cells are being rejuvenated. They are being repaired. So as a gradual point, all those things begin to come up. After stem cell therapy, they're able to see more results because of what the stem cell has gone to the central nervous system to begin to repair and to correct some errors. So we are not really looking at the peripheral, handling the disease from the top. We are going deep to the cell because majority of diseases are born out from the damage of the cell. Okay, the take-home message is the fact that number one, it's a message of hope. Two messages of hope that what we can enjoy anywhere in the world, we can also enjoy that in Nigeria. Now, Nigeria is also becoming a place where regenerative medicine Nigeria is becoming a home for regenerative medicine. You know, people are coming all the way as far as different countries to enjoy regenerative medicine treatment in Nigeria. And also number two is the fact that some of the major diseases that people feel that they will have to just live with it till they die, there is hope for them.
Talked about getting stem cell from placenta. How do you intend to handle the cultural belief that people don't want to release their placenta for various reasons?
The challenge at the moment for the stem cell therapy, it's actually in terms of finance. Basically because we are still in partnership with an international organization. We don't have a processing facility where we process the stem cell here in Nigeria. So it's still a high-tech procedure, even outside the country. It's still very expensive. Even sickle cell treatment is still expensive. Stem cell therapy is still expensive. That's one of the challenges. And when it comes to the source of stem cell, at the moment, we are not. The only thing we advise patients is, for parents rather, they can store the cord blood, they can store the cord tissue. Now, we are not asking people to donate. So, in the case whereby to start bringing disbelief and trust issues that what are they going to do my baby's placenta? In developed countries, patients will tell you that they will give you a form, and the form is, do you want the placenta discarded or do you want it stored? Probably for clinical purpose, for research purpose, or for therapeutic purpose. So people sign, people believe in a system is working, the country is working. But here in Nigeria, that we don't even have a banking system that we can do that. The only place we do that is that we store it in the UK or in the US. So we are not really saying people should, at the moment, stop, or we are not even asking people to donate. So for people that want to even go with stem cell therapy, it's not necessarily they have to make use of their immediate immediate children or child's placenta. Now, we have different facilities in the US, we have different facilities in the UK that process stem cells. So what we do is that for people that they don't have a cord blood or cord tissue stored somewhere, majorly for neurological cases that doesn't need a match, you don't need to attach a match to it. It's only cases like sickle cell and other blood-related issues that need a match. That is when we are so concerned about getting somebody from the family. But for diseases like stroke, autism, that you don't need a match, you don't even necessarily need to bring placenta or look for placenta or look for cord tissue. There's a facility already outside the country that does the processing. What we just do is the fact that for such treatment, they make requests. A particular patient needs this particular stuff, needs this particular treatment, and then we ship in the cord tissue for treatment. So it's not that we're asking people, before you can have this treatment, bring placenta, bring umbilical cord, bring this, bring that. So in that regard, so we don't have issues with people in that regard.
What can government do to get this working in Nigeria?
Number one, we need an enabling environment for power supply. We need an enabling environment for research. A lot is going on in molecular medicine. A lot is going on in genetic medicine. A lot. Now, the world is revolving. The world is almost going off from clinical medicine. Clinical medicine is just amplifying what is undergoing behind the scene, which is through the help of research. So the government should invest more in research medicine, because research medicine is the key at the moment. So the government should provide an enabling environment and also to invest in research. And also, the government should also make sure that, or should partner with organizations that are ready to make this easy. So at the moment now, we are also trying to set up a foundation aside us treating people. We're trying to set up a foundation to assist children, because we realize that many children are in need of regenerative medicine as their last hope. So the government should try and partner with organizations or people that can bring this to a very minimum level. At the moment, sickle cell disease is still a terrible thing. Nigeria happens to be the epicenter of this disease. sickle cell is not out of it. So if the government is partnering with organizations that can help in subsidizing all these processes, perhaps we even have a processing facility here in Nigeria where we process the stem cell, either the hematopoietic stem cell or the mesenchymal stem cell, or we also have a bank here in Nigeria. I'm so sure that instead of spending millions of naira running a procedure, it might just be a million naira or less than that. So the government should create and try to partner with people, try to partner with organizations, either international organizations or local organizations, to make sure, because a lot of people are in need of this, a lot of people at the moment. When we go to our teaching hospitals, we see people that they are just there. They don't have hope again, because based on the fact that there's a limit to what clinical medicine can do. But imagine a government seeing the need for regenerative medicine and trying to, key into it. I'm so sure that the workload on our clinicians will reduce.
It was nice having you on the show. You're welcome. We appreciate it.
My name is Dr. Shodikpo Oluwajimi. I am a consultant family physician. I've been to the isolation center and I've seen people struggling to breathe while they use oxygen. We have a responsibility to prevent this deadly illness. Use your face mask. Practice social distancing.
Wash your hand all the time. Prevention is better.
Together, we can fight coronavirus.
It's Health Affair on AIT, and next on the program is our nutrition segment. African walnuts are fruits of a woody perennial climber plants found mostly in the dense rainforests of Africa. It comes in a hard kernel casing, which releases a whitish round nut when cracked open. The shell color ranges from black to any shade of brown. The fruit has a firm and crunchy texture with mild flavor when cooked, but upon drinking water after consumption, it gives a bitter taste sensation attributed to the presence of some variants of chemical alkaloids and phytochemicals, which has no toxicity and of no danger to humans. African walnut has a long history as food plants. Its economic importance lies in the edibility of its oil-rich endosperm, which is consumed by diverse populations in Nigeria, Sierra Leone, and the Lower Congo region. Although it is believed to have originated in southwest Nigeria, where it is usually cultivated by subsistence farmers in the hot and humid zones of tropical Africa, in compound gardens and backyards, just for family and local market consumption. Today, it is widely cultivated from Sierra Leone to Angola and in the Democratic Republic of Congo, Nigeria, India, Cameroon, Gabon, and Niger. Every part of the African walnut tree is used in both raw and finished states. Its timber and nuts are used to produce medicine for kidney problems. The wood is used to make pilings for bridges and railway ties. The fruit is cooked with its shell at a boiling point temperature, above the boiling point of water, and left for up to 10 minutes on fire. It is served with its shell, which must be removed before eating. In a similar way, it can be baked in the oven by placing raw nuts on a pan and put in an oven for 15 to 20 minutes. They can as well be served roasted as healthy snacks. African walnuts are seasoned fruits with enormous nutrition and health benefits. These nutritional contents in walnut provide immense benefits to the human body in several ways. The nutrients include antioxidants, minerals, vitamins, and some plant compounds that the body requires daily for overall maintenance and development. A 100-gram serving of shelled walnut contains or supplies 350 kilocalories of energy, 13.14 grams of carbohydrates, 24.0 grams of protein, 12.39 grams of fats, vitamin C, vitamin E, vitamin B6, B7 and thiamine, minerals, calcium, potassium, magnesium, zinc and sodium, omega-3 and 6. African walnuts help to prevent some mineral and vitamin deficiency. Eating this fruit helps also to protect you from certain chronic diseases. On our perception segment, we give you vital health tips to stay healthy.
Never, ever, ever, ever ignore your body. The body gives you signs. Hardly do things happen suddenly. Heart attack, brain attack, this attack, they don't happen that sudden. They will call them sudden attack, yes. Sudden because we were ignorant or we were deaf or we ignored. The body has been trained by God to give you signs. It's like a car that the fuel is about to stop. It makes boom, 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 boom. It hardly does it stop, bam. So the heart doesn't shut down that way, unless there's a chronic invasion, acute invasions, right? Otherwise, it's a chronic matter. It keeps going worse and worse. That's why we need to do their medical checkup, go to the doctor, go to the hospital, go to the pharmacy, and then the doctor will send you to a lab, and the lab scientists will test you and send the report back to the doctor, based on which the doctor will write his prescription, and you go to the pharmacy, you procure your prescription. If you need admission, the nurse puts you to the bed and ensures that you are taken care of. This is the way the work is divided. If we do them that way, your health will be improved and you live long to enjoy life.
We welcome your contributions on how to improve the nation's health sector and human lives on our perception segment.
Teaching hospitals are called teaching hospitals because you have a lot of specialties. You have a lot of consultants within the hospital. But once you don't have this set of people, it becomes a normal hospital. So you don't have specialists, you don't have a urologist, you don't have a neurosurgeon. And whether we like it or not, we are all aware that our good hands are leaving the country. As a matter of fact, the best brains are leaving the country. And if this continues, we can all add one and one together. And we'll definitely know that at some point we'll have dearth of specialists. And the masses, unfortunately, would suffer for it.
This is where we draw the curtain on the program today. Thanks for spending your time with us. Let's do it again, same time next week. Please support the program by advertising your health products and services. We do it for you at a subsidized rate. My name is Ushuo Mowa Daniels. Please keep staying safe.